So now that I have an idea of where the scar tissue is starting to build up, I can use a more specific, a deeper tool here. It's HD9, and I can kind of really get into that insertion point of subscapularis. Okay. My most commonly injured rotator cuff group that I see is supraspinatus. So we usually like to attack that as well. And the way we access that tendon is have Kelly put her arm on her shoulder. I'm sorry, on your hip. Yep, you got it. Stacey knows.
Yes, ma'am.
You feel a little bit of a difference in the amount of scar tissue in this area, and actually that doesn't feel all that bad today. Considering the fact that she had a really heavy weekend as far as the shoulders go, I'm really happy with what we're seeing here. Okay. Now we're using different strokes for these areas. If you want to learn a little bit more about it, look up HawkGrips.com or check out our website and find out when another seminar is. We're not limited to teaching chiropractors. We also teach physical therapists, massage therapists, athletic trainers, you name it. We've had them pop in. Now, in a specific area, we're looking at about 60 to 90 seconds per muscle group is effective enough to get the desired result. All right. Now, it's important as a doctor, really, of any profession, to kind of know your athletes. So know their weaknesses, know their strengths, know where they might have these potential pitfalls. To again, what we want to avoid are these season-ending injuries. All right. It's not a good look for anybody to have their patients or athletes getting injured. So as far as the CrossFit athlete goes, most 99% of them are really strict on their diet, on their exercise, obviously. But one thing they tend to miss out on is the recovery and the treatment process. Just like any athlete, recovery and performance enhancement is key. Now that doesn't have to be chiropractic, but it could be acupuncture, it could be PT, it could be anything. Now, what I'm using now is a multi-tool. So it basically combines 4 of the gold set of our HawkGrips. It's a great tool, especially if you're on the road, if you're at a competition or a 5K or anywhere. You can really help your patients out by just not having maybe a whole set, but just taking this multi-tool and treating that way. Okay. Now, Kelly, a few, what was it, maybe 6-7 months ago, you had a little bit of an issue in the deltoid.
Mm-hmm.
Any problems with that?
No.
No, okay. That's kind of an unusual area. We talked about that a little, Kelly, when you had it. But like I said, most of the issues that we find are in her rotator cuff group. But this was a deltoid injury that hasn't popped up in well over half a year. And the hamstring issue was fine? Mm-hmm. Good. All right. So what I'm going to do, like I said, 60 to 90 seconds is plenty. Now this new emollient that we're using is made for superior adhesion for scraping and then taping. So we don't really have to clean the area afterwards. Any other emollient that I've used, you have to wipe down, clean the area very, very well. It's time consuming and it's a little bit frustrating if an athlete just needs to get treated real quick, taped up, and then back on the course or at the event. So what we're going to do is just cut a couple strips here. So what we're going to do, we're going to have Kelly bring her arm out, and we want to get this muscle stretched. Okay. And again, this is my kind of rotator cuff protocol. Nothing fancy, but if you kind of want to learn a little bit more about taping, just give a look to I'm sure HawkGrips has some information. We also have some information on our website as well. Just give it a rub to make sure the glue activates, and we'll have you bring your arm back. Good, perfect. And we want to go right over those insertion points. That is the most important part of the taping process specifically. So what we're doing is just really activating the inflammatory process, hopefully get the body to lay down quality fibers as opposed to the scar tissue that we're feeling. Okay. All right, guys, you can relax. And we're all set.